Hello and welcome to Straight Talk. I'm Aisha Subarkash. The number of coronavirus cases across the world continue to climb. More than 3 million people have been infected and nearly 250,000 have lost their lives. What started in China quickly moved to Europe before engulfing the United States. But one part of the world has been largely spared. Although the number of COVID-19 cases and deaths remain relatively low in Africa, the United Nations and other aid groups warn that the continent's fragile health system could make it the world's next epicenter. Let's take a look at this report. And joining me to discuss what's at stake for the continent from Nairobi, we have Liz Nganga, who is a researcher on Turkey-Africa relations. From Johannesburg, we have Shabir Madhi, who is a professor of vaccinology at the University of Witwatersrand. And from Ankara, Ugur Tanyeli, who is the head of External Relations and Partnerships Department at TIKA, a Turkish government agency that helps distribute developmental aid. Hello, welcome to Straight Talk. It's good to have you all on the show. So, Shabir, let me begin with you. Africa has seen a 40% rise in the number of cases in the last 10 days, unfortunately, sparking fears that the continent is in the early phases of the outbreak. Could you give us an overall view on the continent amid the crisis? What is being done to prevent the worst case scenario?
So good day to you. So thank you for having me. So I think the reality is that much of the increase in terms of number of cases is largely driven by the increase that's emanating from South Africa. And there's a reason for that. And the basic reason for that, in South Africa over the past 12, 15 days, there's been an escalation in terms of the number of testing that has been done. And this is one of the major challenges that Africa faces in terms of being able to quantify the exact magnitude of the number of cases throughout sub-Saharan Africa, for that matter, in that there's very limited capacity in terms of doing testing. And in the absence of being able to do testing, you're really unable to quantify the magnitude of the disease. And a good example was from the 2009 swine flu, where the majority of deaths that actually occurred in Africa. Yet the minority of cases that were confirmed as being swine flu in 2009, 2010 were again from Africa. So there's a disconnect in terms of the amount of disease that occurs in Africa and our ability to actually be able to test, to actually qualify and quantify the magnitude of the problem.
So testing is crucial here. So Liz, on the other hand, the World Food Programme has also warned of a hunger pandemic where countries in Africa could face starvation if the virus were to spread that rapidly. Which sectors are to be affected most and what would be the consequences?
As you mentioned, there's going to be a huge impact of this crisis on the food systems globally, but in Africa as well. So what we know is that at the moment, farmers, for example, in Kenya, farmers are not able to get their supplies, their fertilizers, their seeds, because this is a planting season. Nothing is happening, nothing is getting to the farmers. So there will be a shortage in that sense. But we also have to keep in mind that there are other crises that are parallel to the COVID. For example, in Eastern Africa, we were facing the locust invasion, which we should be tackling in terms of food security. We are not able to progress as fast as we would. So these two sets of challenges are moving together. In terms of what sectors are going to be affected most, I'd say all, but mainly the staple crops, the maize, the beef, which most communities depend on, because this is the time they would be planting. So those will be disrupted significantly. However, I do know that there are very many numerous efforts going on now from national institutions, from development partners, to ensure that at least some level of activity is going on from an agricultural point of view. Is just so that there's a lot of thinking about post-COVID food security going on at the moment, which is encouraging.
Yeah. The UN Economic Commission for Africa said at least $100 billion is needed urgently for African countries to address the immediate safety need nets for their populations. Turkey is also launching some operations in Africa, let's say. It has sent medical aid related to the coronavirus to over 57 countries, if I'm not mistaken. Ugur, tell us about TIKA's latest operations in the continent. What do you do to mitigate the effects of the coronavirus, and what is needed the most?
Thank you for having me. As we all know, coronavirus is a global threat for all of us, for all countries, and it cannot be beaten by the single effort of the one country or the countries. So as of yesterday, all around the world, there are more than 3 million cases with more than 230,000 deaths.
Yes.
So this spread of the virus can only be tackled down globally. So considering these circumstances, just after the outbreak of the coronavirus, we have planned three phases of a plan of action. So the first was to protect our staff abroad and keep our offices working on the field. And
so, Ugur, could you give us some details? Because we know that Turkey has already sent medical aid to Guinea, Somalia, Lesotho, South Africa, and Uganda. Shabir was just mentioning how important testing is. So do those countries need testing kits or protective gear? What do they need the most at the moment?
As you mentioned, the protective kits, masks, disinfectants, and gloves, the protectable suits are the most needed ones. We as TIKA, as some flights has been cancelled, we procured local procurement, and we help our partners on the field with the necessary equipments.
All right. So, Shabir, let me get back to you. The World Health Organization has also said there could be 10 million coronavirus cases in Africa unless the necessary measures are taken. So several countries, including South Africa, Ghana, and Rwanda, have announced partial reopenings of their economies after weeks of lockdown. Do you think these countries are moving too fast?
No, certainly not at all. And I think we really need to be careful. A lockdown does not eliminate the virus. And that is unfortunately something which many African countries fail to conceptualize. There's a very specific purpose to a lockdown. The lockdowns that we're seeing in Europe is very different from the reasons for the lockdowns we're seeing in Africa. In Africa, there's a false belief, unfortunately, that the lockdown is going to eliminate the virus. At the early stage of the epidemic, a lockdown has got specific sort of purposes. The one is to sort of try to reduce the community transmission. The second is to give healthcare facilities an ability to scale up their preparedness. And the third and most important part of it is to be able to identify infectious cases, put them into isolation, trace their contacts, and put their contacts under quarantine. Now, the third is probably the most important part of it. And as I mentioned, in the absence of being able to test, you're not able to actually implement the third part. So the lockdown, in fact, in many African countries, as you heard before, is actually causing greater harm than good. right? In the absence of doing what you're supposed to do during a lockdown, it does not achieve anything. So the phasing out of the lockdown, in fact, many countries in Africa should not have adopted the lockdown. There's almost a contagion of lockdown, which has got a potential of creating worse, more negative effects than any good.
Yeah.
In terms of the indirect effect, as you've heard, the economy is being trashed, and there's also indirect health consequences that are emanating from the lockdown. Children are not being immunized, as an example.
Okay, so Liz, would you agree that because as Shabi just mentioned, this lockdown has put tremendous strain on the economies where millions of people just survive off their daily wages. Could you talk about how these lockdowns have affected African countries economically and what's the way out?
Yes, I think what the lockdown has done, it's revealed, not surprisingly, but it's made it very clear that there's a huge section of communities in Africa, a huge demographic that survives this way, that what they earn in a day is what they spend. And that group of people has been very, very much affected. Now, on the other hand, is that it has revealed the ingenuity, the human strength among people. And we're seeing an emerging, of course, there are people who are suffering very significantly, and it's very clear and it's very well reported. However, we've seen a lot of people who are being resourceful and doing what is being called the lockdown hustles, just trying to be innovative and to work around the problem. Now, what I think post-COVID, all of us, we must evolve. And I think one of the lessons that we need to take forward is that we must invest in people. Countries like Turkey and other development partners of Africa, this is a time to start investing in people. By that I mean invest in our scientists, invest in training more young people to become scientists, to become innovators, to become entrepreneurs, invest in people to translate the latent capacity in them into enterprises so that they do not have to depend on a factory or, an outlet for their survival, because the human strength is there.
Yeah, Turkey has deep-seated relations with Africa culturally and historically. It already has 41 embassies across the continent, and Turkey has free trade and cooperation agreements with those countries on various sectors. So how well positioned Turkey is to step in and help African countries if these outbreaks do spike?
Yeah, actually, Africa is a very important partner for Turkey because in the last decade, we have been witnessing the intensification of relations between Africa and Turkey. As you mentioned, the number of our embassies has been increased. The number of TIKA offices and the other government institutions, Turkish Airlines flights were very intensified in the countries. So I think despite of that virus, the Turkey's motivation for Africa will last, and it will not affect so much the Africa. For example, to help the African countries to fight against the coronavirus, we have realized more than 50 projects in 22 countries in the world, in the Africa.
Yeah, and this currently, we know that, as you have written in one of your articles, Turkey is ranked second after the US in terms of the volume of development aid to Africa. But what should be done further to attain sustainable development and lucrative trade ties for both sides moving forward?
So yes, it's true. And the indicators like the number of embassies, the number of airlines, the volumes of humanitarian aid do speak in favor of Turkey. What now needs to happen, the next step, is how does this translate into real benefits for ordinary people? So, and like I said, one of the ways would be to contribute to that investment in the individuals, and that will have its own spin-off effects by contributing to the training of more scientists in Africa and in Turkey. I know there is a lot of educational scholarship going on, but also support Africans to be trained in their own continent on African problems.
Shadi, let me get back to you. With no vaccine expected to be found yet for another year, how do you think especially sub-Saharan countries will handle the fallout of this virus?
Yeah, look, so I think under the best of circumstances, the reality for many sub-Saharan African countries is they've got very fragile healthcare systems. Yes. And any sort of planning around this virus needs to accept that this virus is not going to go away at the end of 2020. In fact, if anything, this virus is going to be with us for the next 2 to 3 years. And that is the experience from previous pandemics, including the 1918 pandemic, is that you get multiple waves of the virus before you get sufficient number of people in a community that does sort of develop immunity and which impacts on ability of the virus to transmit. So whatever is done now can't be done for the next 2 to 3 months. The planning cannot be for the next 2 to 3 months. That will miss the target. The end game here is how are we going to mitigate the full effects of this virus in resource-constrained countries over the period of the next 2 to 3 years.
Yes, all right. I'm afraid we're out of time. Thank you for all for joining us on Straight Talk. Appreciate it a lot. For the world's 1.8 billion Muslims, the holy month of Ramadan has taken on new meaning amid the coronavirus pandemic. What was once a time to gather by the thousands to pray and break their fast has been replaced with the new reality of social distancing. Although mosques have closed across Turkey and the world, Muslims are finding unique ways to ensure this holiday stays as true to form as possible. And to discuss that, I'm joined by Mutaz Alkhatib, who is an assistant professor at Hamad bin Khalifa University's College of Islamic Studies in Doha, Qatar. Mutaz, welcome to Straight Talk. It's good to have you here. So we're already in a week into Ramadan. Generally, Ramadan involves a number of community gatherings ranging from Tarawih, the evening prayers in mosques, and iftars where people, families and loved ones get together. But amid the COVID-19 pandemic, Ramadan has taken on a new meaning. How does it look like now?
Thank you very much for this invitation to me for being with you and your audience. First of all, I would like to stress that this pandemic is not a unique. Maybe it's a unique for us in this current time, but during the history we witnessed a series of plagues and pandemics, and this was reflected in a huge literature on plagues, which reflected Islamic historical experience, and in this literature we can find a lot of discussions which has a multifaceted character that addresses scriptural, theological, juristic discussions, etc. So. And scholars were in the classical time were busy with different questions, such as performing religious rituals that you are asking about. So it's not an easy situation to live in this context and difficult times for people. Especially if they don't have an idea about the history, what happened, the history.
Yes.
So in these discussions, I usually the key question here is what to do in such a situation.
Yeah, I'm going to ask you about this because we know that many Islamic holidays have a heavy social aspect to it. So how do you think the Muslims will manage to adapt to the new normal since the virus will be around for some time?
I think there is a positive aspect of this situation, that people, it's a good chance for people to go back to their selves, and to even though that it's really hard to isolate yourself in the context of technology, but it's a good situation to do critical assessment, self-critical assessment, and reprioritize your priorities in life. As for worship during Ramadan, we have to be aware that Taraweeh prayer is in principle performed at homes. It's a recommended action, and it should be performed at home. And this is a good chance for individuals to take their responsibilities and to strengthen their moral conscience, individual conscience.
We also, and currently there are lots of virtual gatherings, we know that. But tell me how difficult it is for older generations to adapt to that as well, because they're not very well accustomed with the technology.
I think this is a good chance for them to train themselves and to depend on themselves, not to just follow the imams or just going for gathering prayers or even Friday prayers. In the Islamic jurisprudence, we have a huge chapter on what we call it rukhas or a'dhar, causes that allow people, allow individuals to not go for the usual actions, religious actions, and to find alternatives, many alternatives that which is available and accessible for everybody.
Okay. On the other hand, we also see anti-Muslim propaganda seeping into online discourse about this coronavirus, especially in India, the US and the UK. Some far-right groups, especially in US, have spread anti-Muslim propaganda, saying that the churches in the country will be forced to close during this pandemic, but the mosques will remain open. And India, some extremists scapegoated the Muslim population by saying that they're deliberately spreading the virus. So has coronavirus been made yet another tool for xenophobia and Islamophobia, and how to deal with that?
I think this is a very important point, even because in the secular bioethical discussions and even the Western media, there was much focus on the actions made by churches and mosques. But nobody was, or at least, the discussion about the sport activities and other gatherings were not so much focused on. And then this is a kind of bias against the Muslim rituals, because at the end we have many activities and gathering activities where still remain and inactive,
Yes.
So this is a very important point here. But at the same time, we have to be aware that this is not the first time that mosques and even Hajj cancellations. This is not the first time that we witnessed this.
I was going to ask you that. Could it be possible for Hajj to be cancelled this year?
Yes, this happened in the past. This happened many times. We know for different reasons. But the new issue here now, the new issue that Hajj cancellation was not because of the fear of contagion. This is a very important point here. Contagion was one of the key issues, controversial issues in the history. In the past, because of the available and accessible medical information at that time, but now there's no question about contagion. But, so but in the 19th century, for example, Hajj was cancelled because of plague and cholera, for example. So we have what happened in 1831, between 1837 and 1858. There was a series of epidemics, and Hajj was cancelled because of these epidemics.
All right, Mutaz, unfortunately, we're out of time. Thank you very much for joining us on Straight Talk. And that's all for this edition of Straight Talk with me, Aisha Subarkash. If you've got any comments, do share them with us on Twitter with the hashtag Straight Talk. Also, don't forget to subscribe to our YouTube channel. We'll leave you with these pictures that show how the coronavirus pandemic has affected Ramadan celebrations compared to earlier times. Until next time, take care and goodbye.